Welcome, curious minds. Today, we're taking a deep dive into a disease that, well, for most of us, likely resides in the dusty corners of history books, if we've heard of it at all. It's a disease primarily of horses, donkeys, and mules, but with a shocking and frankly critical twist, a high risk to humans.
That's right. And our material for this deep dive comes from some pretty detailed sources, specialist standard study guides and research focusing on glanders, equine zoonotic disease and management dated June 23, 2025. These sources don't just, lay out the facts. They really highlight the critical implications of this disease's unexpected reemergence. So our mission today is to understand what glanders is, why it's suddenly back on the radar, and what makes it such a significant concern, especially, as you said, its potential threat to human health.
Okay, ready to maybe unearth some astonishing facts? Because this disease has a truly formidable reputation. Let's dive in. So, to kick things off, let's define glanders at its core. What exactly is this disease we're talking about?
Well, fundamentally, glanders is a highly contagious infectious disease, often fatal, actually. It's caused by a specific bacterium, Burkholderia mallei. That's what we call a gram-negative bacillus, basically a rod-shaped bacterium. And its main targets are equids, so horses, donkeys, and mules.
You mentioned it has quite a dramatic history. What made it such a global problem in the past, and how did we manage to get it largely under control?
Oh, it was absolutely rampant.
Yeah.
Worldwide. But through decades of really rigorous public and animal health efforts, primarily these test and slaughter programs, it was largely eradicated or, effectively controlled in many developed nations.
Yeah.
Think North America, Western Europe, Australia, Japan, places where for a long time it essentially just vanished.
Right. But here's where it gets really interesting and maybe a bit concerning. Despite all that historical success, glanders has actually started reemerging. We're seeing it pop up sporadically again, haven't we? In parts of the Middle East, Asia, Africa, Central and South America. What's driving this comeback?
Yeah, that's a key point our sources emphasize. A big driver seems to be the increasing global movement of horses. More trade, more travel. A recent outbreak in Germany, for instance, really underscores this. It shows glanders isn't just some historical curiosity anymore. It's a re-emerging threat with potentially global reach.
So it's clearly not just an animal health issue then, is it?
Not at all. And what's really crucial here is that glanders is classified as a notifiable disease. It's listed by the World Organization for Animal Health. That's WOAH, used to be OIE. This means any suspected or confirmed case must be reported immediately to the veterinary authorities. It's taken very seriously.
And speaking of classifications, our sources mention Burkholderia Mallei's designation as a Tier 1 biological agent. Can you break that down? What does that mean in practical terms? It sounds quite chilling.
It is a chilling designation. That Tier 1 classification isn't just, some bureaucratic label. It fundamentally shifts how we see this. It's not just an old animal disease. It's a modern, high-stakes biosecurity concern.
Yeah.
It really stems from two key factors. One, its incredibly high mortality rate in untreated humans. And two, its potential for aerosolization, which means it could theoretically be spread through the air easily or even weaponized. That has very serious public health implications.
Okay. To really get a handle on the threat, maybe tell us a bit more about the culprit itself. What makes this Burkholderia mallei bacterium tick? How does it survive?
Right. So B. mallei is, as I said, a gram-negative bacillus, and it's non-modal, meaning it doesn't move on its own. Now, it is susceptible to common things like heat, drying out desiccation, and direct sunlight. So that's good. But it has a clever survival trick. A polysaccharide capsule. Think of it like a protective coat. This allows it to hang around for extended periods, weeks, even months, in moist, humid, or wet places, like contaminated water troughs or damp, stable bedding. On the plus side, though, it is susceptible to common disinfectants. Proper cleaning works.
Let's bring this back to the human aspect you mentioned, the critical risk. How does glanders actually make that jump from an infected horse or donkey to a person?
This is really the most critical aspect, the zoonotic potential. Humans can get infected in several ways. Most commonly, it's through direct contact, touching infected animals or handling contaminated materials like their discharges, tissues, that sort of thing. The bacterium can get in through small cuts or abrasions on the skin, or by contaminating mucous membranes, eyes, nose, mouth. Inhaling aerosols is also a known route. This is a big concern in labs, hence the BSL-3 requirement we'll probably talk about. And it links back to that Tier 1 potential, the bioterrorism angle. And though it's rare, ingestion of contaminated meat has occasionally been reported as a route too.
Wow. And the impact if someone does get infected, it sounds devastating. What does a human infection actually look like?
It really is devastating. The clinical forms in humans can vary quite a bit. You might see localized lesions on the skin, or it could affect the nose or the lungs. There are also septicemic forms where the bacteria get into the bloodstream and spread everywhere. And it can even become a chronic, sort of disseminated infection that lingers throughout the body.
And you mentioned the mortality rate earlier. Just alarming.
Extremely alarming. In untreated acute human cases, the fatality rate can be as high as 95%. 95. And even if you catch it early, even with aggressive treatment using multiple antibiotics, our sources say the fatality rate can still be around 50%. 50. This disease is incredibly serious in humans. It's not something to be taken lightly at all.
Given those terrifying numbers, who is most vulnerable? Who needs to be most careful?
Well, primarily it boils down to occupational risk. People who work in close, direct contact with potentially infected animals, that's veterinarians, obviously, horse caretakers, stable hands, farriers who work on hooves, slaughterhouse workers too, and of course, laboratory personnel who are handling samples or trying to culture the bacteria face a significant risk.
Which absolutely underlines the need for non-negotiable safety measures.
Precisely. There's no cutting corners here. Strict adherence to personal protective equipment, PPE, is mandatory. We're talking disposable gloves, a properly fitted N95 respirator, or at least a surgical mask, goggles, or a face shield for eye protection, and protective clothing. Anytime you're handling suspect animals, confirmed cases, or samples taken from them, full PPE is essential.
Okay, we've definitely established the serious human toll this disease can take. Let's shift focus a bit back to its primary hosts, the equids. How does Glanders typically move through animal populations?
Right. So in horses, donkeys, and mules, the primary way it spreads is through ingestion. That's considered the most common route. Animals consume contaminated feed or water. Often this happens because nasal discharges or pus from skin lesions from an infected horse contaminates shared facilities, like a communal water trough or feed bin. Inhalation of aerosols generated by coughing or snorting infected animals is another way. Direct contact is also important, getting infected discharges onto skin abrasions or mucous membranes. And finally, fomites. These are inanimate objects that can carry the infection-contaminated equipment. Tack like saddles and bridles, grooming tools, even buckets.
So it sounds like it can spread quite easily in a stable environment, but it's not always obvious, is it? You mentioned something about a silent danger earlier.
Exactly. And this is a really critical point for understanding why it can reemerge and be so hard to eradicate. It's the issue of asymptomatic carriers. Horses, particularly, can develop latent or chronic infections where they appear perfectly healthy, clinically normal. But they can still harbor the bacteria and shed it, sometimes intermittently, sometimes constantly. These animals act as dangerous, silent reservoirs. They keep the infection cycle going and pose a huge risk for introducing it into new populations. It makes surveillance incredibly tricky.
So if a horse is showing signs, what does Glanders actually look like in them? What are the telltale signs someone might spot?
Well, that's another tricky part. It's quite varied. An animal might have an acute, rapidly developing form, or a more chronic, long-lasting one, or be in that latent, asymptomatic state. And often cases actually involve a combination of different forms. But to give you some examples of the classic forms described, there's the nasal form. Here you might see a high fever, the animal looks depressed off its feed, and there's usually a thick, yellowish-green nasal discharge, often sticky, sometimes even bloody. Inside the nostrils, especially on the septum, the wall between the nostrils, deep ulcers can form. These can actually merge and even perforate the septum. A really key sign, though, is that when these ulcers heal, they often leave characteristic star-shaped scars. That's a big clue for vets.
Okay, star-shaped scars. What about other forms?
Then there's the pulmonary form. This often involves the lungs, causing severe difficulty breathing, dyspnea, a moist cough, and signs of pneumonia. This form tends to be more common and more rapidly fatal in donkeys and mules compared to horses. In horses, the lung form is often more chronic. You might see gradual weight loss, maybe a persistent dry cough, general poor condition.
And the third type?
That's the cutaneous form, which historically was often called farcy. This involves the skin and the lymphatic system under the skin. You see these nodules, like little lumps, forming along the path of lymphatic vessels. These appear typically on the limbs, especially around the hock joint or inner thigh, but also on the muzzle, neck, or flanks. These nodules tend to rupture, forming crater-like ulcers that discharge this really thick, oily, almost honey-like pus, which is highly infectious. Like the nasal ulcers, these heal slowly and also tend to leave those distinctive star-shaped scars. You might also feel or see what are called corded lymphatics. The lymph vessels themselves become hard, swollen, and feel like ropes under the skin.
Wow, those descriptions are quite graphic. Given how dangerous this is and how varied the signs can be, how do vets actually confirm it's glanders?
Right.
You said clinical signs alone aren't enough.
Absolutely not. And the first step, always, is that any suspicion of glanders must be immediately reported to the veterinary authorities. That zoonotic risk makes it a public health emergency, essentially. Clinical signs can raise suspicion, sure, especially those star-shaped scars of the corded lymphatics, but you need laboratory confirmation for a definitive diagnosis. And that diagnostic process is rigorous. Because the bacterium is so dangerous, laboratory work involving culturing it requires biosafety level 3 BSL-3 containment. These are specialized labs with strict safety protocols. The gold standard test is actually isolating and growing the bacterium, B. Mallei, from samples taken from clinical lesions like the nasal discharge or pus from skin ulcers. There are also molecular diagnostics. Real-time PCR assays can detect the bacterium's DNA quickly and specifically. Very useful. And then there are serological tests, which look for antibodies in the blood. The complement fixation test, or CFT, is the one recommended by WA for screening populations. Other tests like ELISA and Western blot can be used for confirmation. Finally, there's a test called the Mallei test. It's a bit like the tuberculin skin test. A protein extract from the bacteria called Mallei is injected into the skin of the lower eyelid. A positive reaction involves localized swelling, maybe some discharge, and tenderness within 24 to 48 hours. It's mainly used for screening large numbers of animals, especially in areas where glanders is known to exist.
Okay, so you get a positive confirmation from the lab, or maybe a positive melon test reaction. What happens then? Is there a treatment protocol? Antibiotics.
This is where it gets really difficult, especially for owners. The hard truth is that in most countries, treatment for glanders in equids is generally prohibited and contraindicated. Particularly in countries that are trying to eradicate the disease or maintain a glanders-free status, the policy is almost always mandatory euthanasia and safe disposal of the carcass for any confirmed positive animal.
Wow. Euthanasia. Why
Yeah.
such a drastic measure? Why not even attempt treatment, especially if it's a valuable or, a beloved animal?
It sounds harsh, I know, but the rationale is very clear and, well, based on protecting the wider population, both animal and human. Firstly, and most importantly, is to protect human health. That zoonotic risk is just too high to gamble with. Secondly, it's to prevent the spread to other susceptible animals and stop the disease from becoming established again. And thirdly, and this is a critical point, treatment, even with long courses of antibiotics, doesn't reliably clear the infection. It doesn't guarantee a bacteriological cure. So, treated animals might look better, their symptoms might resolve, but they can still become those dangerous asymptomatic carriers we talked about. They can continue shedding bacteria and pose a persistent hidden risk.
Okay, that makes sense, even if it's a tough reality. So if treatment isn't really an option for the animals, what's the overall strategy? How do authorities try to contain glanders and prevent it from spreading?
Yeah, the focus has to be squarely on prevention and control. That's the key. It involves several layers. First, vigilant surveillance, actively looking for cases, and that mandatory reporting system we discussed. Then, implementing those test and slaughter policies where positive animals are humanely euthanized and their carcasses disposed of safely, usually by incineration or deep burial to prevent environmental contamination. And importantly, many successful programs include owner compensation. This helps encourage reporting and compliance, which is vital. Alongside that, you need strict quarantine measures on any affected premises. No movement of horses, donkeys, or mules on or off the property for a set period. Movement controls in the wider area might also be needed. Thorough cleaning and disinfection of infected stables, equipment, everything the infected animal might have contaminated is absolutely essential. And maintaining strong biosecurity measures on all equine facilities is crucial. Things like preventing sharing of feed and water equipment between different groups of animals, quarantining new arrivals, and of course consistent use of PPE by personnel when necessary. And one last important point. Currently, there is no commercially available effective vaccine for glanders and equids. Research is ongoing, but as of now, we can't vaccinate our way out of this.
We've really covered a lot of ground here, this deep dive into glanders. It truly highlights this delicate, sometimes precarious balance between animal health, public health, and our interconnected global world, doesn't it? We've seen how a disease largely consigned to history books can reemerge, its really quite deadly potential for humans, and the incredibly stringent, sometimes drastic measures required to try and contain it. It really underscores how quickly a, quote, forgotten threat can resurface.
Absolutely. And it really brings up a broader question, perhaps for you, our listener, to think about.
Hmm.
In this world where animals and people are constantly moving across borders, how do we effectively balance the need for rapid detection and strict containment of diseases like glanders, especially those with such a great zoonotic risk, with the very real economic and societal impacts these measures have on the people directly affected, like horse owners or communities reliant on equine industries? And maybe what other forgotten threats might just be lurking closer than we think?
Definitely a lot to think about there, isn't it? Thank you for joining us on this deep dive. Stay curious.